Low back pain is terrible. If this is you, if you're having low back pain, I'm gonna walk you through the top 5 exercises that we like to give our clients that I would do myself if I had low back pain that should be able to decrease your symptoms, decrease your pain, and get you moving better at the end of this video. This video should help you a lot if your low back pain is more in the categories that we describe as stenosis, degenerative disc disease, or if you have a low back pain that just feels really restricted and tight and you don't feel like you can move very well. These exercises should help you quite a bit. At the end of the video, after we've gone through them all, you should notice that your symptoms are less, you're able to move better, and your overall pain is quite a bit less. Guys, welcome to the Vulcan Blog. If you are having these tremendous low back pain symptoms, we should be able to help you today. My name is Dr. Sean Hiller. I'm a physical therapist and a certified strength conditioning specialist. We're gonna walk you through the exercises that you need to do, that I would give to a client to help them get out of this nasty low back pain. And your movement feels, for lack of a better term, stubbed up. These exercises should help alleviate that and get you moving better. Things to look out for as we start to treat this is if we're doing these movements and you have pain that goes down your leg, if you have nervous symptoms that shoot down your leg, while we're doing these movements, you should notice those symptoms start to rise, start to centralize or localize. If they're doing that, then that is a great sign. Even if your pain is a little bit worse, that's a great sign. If your pain is getting tremendously worse, that's not a good sign. We need to shift gears a little bit. If your symptoms are peripheralizing, moving further away from the core of your body, those are bad symptoms. You may not have the diagnoses that we have talked about. You may have a different type of low back pain. If so, we have another video for that type of low back pain. We'll link to it in the description, and we'll also link to it later on in the video up top so you can click on that easily. But if you have the type of diagnoses that we've talked about and you have those symptoms in your low back, maybe you have something going down your leg, these exercises should help you, and we're gonna dive into them. In this video, we're gonna walk through all of these exercises together so you know exactly what you need to do to get out of pain and decrease your symptoms. I'm gonna be right there with you. I'm gonna give you the sets and the reps that you need to do, but I'm gonna do them as well. The first exercise we're gonna get into is called a supine knee tuck. You can do this on a table, on the ground. I wouldn't do it on your bed. I would try to find a harder surface. But a supine knee tuck is you're in the supine position. You're gonna take one of your legs, and primarily the affected side, whichever side for you is affected the most, I want you to tuck that knee to your chest and then let off, okay? We're gonna go through 10 of these. Tuck it to your chest, hold that for 2 or 3 seconds, and then come back up. If this feels good, if you're like, oh, this helps a lot, then feel free to grab both legs at the same time and just tuck them together and come back down, okay? You can do both at the same time with this, or you can do a single leg. Sometimes if your pain is tremendous, if you're having 9, 10, 11 out of 10 pain, if you know what I'm talking about, you can just do one at a time. That may be easier for you to do. We're gonna do 10 each side or 10 together. If this feels really easy for you and you're like, okay, this is nothing, then when you tuck that knee to your chest, I also want you to push your kneecap into your hands. So you're gonna get a little bit more of a contraction there. So tuck it to your chest, push the kneecap into your hands for 2 or 3 seconds, and then you can let off. That's how I would advance it if this doesn't feel too difficult. And again, with all these movements, you should notice your pain levels start to decrease and your symptoms start to decrease. Second movement that we're gonna get into is a figure 4 stretch. We can do this in lying on a table or on the ground. We can also do it in standing. I'll show you standing in a minute. But you're gonna put your ankle on your knee, and you're gonna take your other hand, you're gonna push your knee down. This is essentially like a pigeon pose. If we have any yogis out there, you know what a pigeon pose is. But you're in this position, and then from here, you can take the back of your leg, and you can pull your leg to you. You can see I'm not very flexible in this position, but this should help to open up your low back as well. You're coming into this position, and we're going to let off and come back down. From here, we're gonna go through 8 of these each side. Feel free to switch sides. Push that knee down and start to pull it up. You should feel this. We're gonna go through 8 reps each side here with this figure 4 stretch. If that's really difficult for you to do, another way you can do it, you can use a table or something elevated. You can put your leg on the table like so, in this position, and then you're going to try to come over to the ankle. So just like this, This is also a difficult position to do, but this opens up your hips a lot and gives more room for your spine and your low back to move. The next movement that we're gonna do, I want you to take your dowel or your broomstick, whatever you have, make sure it's sturdy, not flimsy. We're gonna lie back down and we're gonna do something I like to call a force counterforce. So we're gonna take our dowel, put it under our knee on one side and on top of the knee on the other side. And now we're in this weird position, okay? What you're going to do is you're going to take this right leg and you're going to push down into the dowel, okay? While you push down with your right leg, your left leg is going to lift up into the dowel, just like that, okay? And your hands on the dowel on the outside aren't letting it move. So you're gonna get this weird co-contraction going on with your core, with your SI joint, with anything around your pelvis. You're gonna get a good, what we call reset contraction. You should reset your position with your low back. So I'm here, I'm going to push and pull, 2, 3, 4, 5, and relax, okay? We're gonna do only 3 of these on each side. Contract, 2, 3, 4, 5. I love the force counterforce position. The force counterforce is known to help reset the pelvis, reset the low back, and allow you to get up and move without as much pain as you had when you first started. We love this position. You can switch sides, go through it again, 5-second contraction, and then let off. Continue to go through these. Like I said, 3 of these each leg. The next movement we're gonna go into, it's much easier if you have some weights. I have a kettlebell here. And what you're gonna do, this is called a Jefferson curl. You're gonna take your weight and you're gonna roll over. I want you to think about moving every single spinal segment individually as you get to the ground. If I was your coach, your strength conditioning coach, and I was showing you how to deadlift, this is not how I would do it. This is not a good deadlift. We're doing a poor version of a deadlift, but it's important to move each segment of the spine. I like to do this before we go into deadlifting. But you're gonna come here, if you don't have weight, you can simply do it with your hands, but think about rolling your spine over. I'm thinking about trying to round my back as much as I can. At the bottom, I may even grab the back of my ankles to get a little bit more flexion, a little bit more rounding, and then roll back up. I want you to do 8 of these with weight if you have it. This is an 18-pound kettlebell. I've done it, you can go as heavy as you'd like to, as long as your pain levels are decreasing, as long as you're not having pain above a 2 or a 3 out of 10. If you started doing these with a 9 or a 10 out of 10 pain, then as long as your pain is getting better, as long as it's getting less, and your symptoms are moving up the leg or dissipating altogether, those are all good signs, keep doing it. So we're gonna roll over. We're gonna go through our 8 reps here with the Jefferson curl, and right back up. After the Jefferson curl, the last movement that we're gonna do to help with these things is we're gonna do an assisted squat. Something that we have to make sure we do with all of these movements is to get back into function. We have to be able to do some things that we're doing in our daily life. There's nothing more functional than squatting. You have to stand up and sit from a chair all day long, and imagine for a lot of you, it hurts a lot when you're trying to go from sitting to standing or vice versa, or getting out of a car. So with the squat, you can use something to hold on to. I'm just gonna use my table here. And we're gonna slowly move into that squatting position. I find this really easy if you can grab a pole or hold on to something to help you get down there. We're just gonna do it assisted style. And you can even use that to bring you back up, okay? If you're going through this and you're having trouble with it, you don't have to go all the way down like I just did. You can stop right through here, just go as far as you can and come back up. If this is really easy and like, I don't need anything for assistance, then by all means, simply go through the squat without using anything for assistance and just go through these movements. That was the last movement, guys. If you have gone through all of these and you're thinking, man, my symptoms are starting to get better, my pain levels are actually getting better right now, then these exercises are for you. What I recommend doing is take these same 5 exercises, do them 2 more rounds, so do 3 rounds total, do them 2 more rounds. So you're gonna start back over, you're gonna work from the supine knee tuck into the figure 4 stretch, from the figure 4 stretch, you're gonna go through the force counterforce, from the force counterforce, you're gonna go back through those Jefferson curls, and you're gonna end up on the squatting. Continue to do that. If it helped the first round, the next 2 rounds, you should feel even better. Your pain should continue to decrease and your symptoms should start to alleviate. If you did these and your symptoms are getting worse, you're thinking, I'm not feeling any better, my pain is worse, my symptoms are worse, then you might not be in those diagnoses that we talked about earlier. You may be more on a disc bulging side or more on a herniated disc or a compressed nerve type of issue. We have another video for that. We can help you with those symptoms very similar to this video. Click on the link here and it will take you to that video, and those things should help you. I'll ask the same 2 questions that I ask in this video. If you would rather be sitting than standing, and you would rather be lying flat on you'd rather be lying in the fetal position versus flat on your side, these exercises are for you. But if you'd rather be standing than sitting, or if you'd rather be lying flat on your back than on your side, those other exercises might be for you. But a great question is, if these exercises help you, keep doing them. If these exercises didn't help you, don't do them. Click on the other video and go to that, and those should help get you in the right position. These are the same exercises that I would do for myself if I was dealing with this issue, the same exercises that I would give my mother, my best friend, and that we give our clients to help them with these issues, and we've had great results with it. If these have helped you, please like this video, subscribe to our channel, and ring the notification bell. It helps so much for our channel reach. We're able to help more people and get more people out of pain altogether. Hopefully this has helped with the back pain that you're having. I'm sorry that you're having it, but we're here anytime you need help, and we'll see you in the future.